Picture this. You're planning to move to the United States. Your bags are packed, your visa is in hand, and you're ready to chase that iconic American dream. But wait. What if the greatest hurdle isn't the visa process? What if the real challenge lies elsewhere, hidden within the systems designed to keep people healthy? In America, there's a silent crisis brewing, and it's not about immigration policies. It's about healthcare, a system struggling to deliver despite its enormous price tag. Immigrants, brace yourselves. This is the story of what awaits you in the land of opportunity. America, a nation often seen as the ultimate destination for success and opportunity. But within its borders lies a healthcare system that's stretched thin, faltering under pressure. Every year, it costs more and delivers less. So what's happening to one of the world's most advanced healthcare systems? Let's dive in. First, let's talk dollars and cents. By 2032, the United States is projected to spend $7.7 trillion on healthcare. Yes, trillion. That's about a 70% increase over just a few years. But here's the kicker. Even as costs soar, access to care is shrinking. Missed screenings, delayed appointments, emergency rooms packed to their limits. It's all part of a storm that's been brewing for years. And who pays the price? You guessed it. Families, individuals, and yes, immigrants. For those new to the U.S., healthcare represents a maze of complicated insurance plans and shocking out-of-pocket costs. Imagine this, barely getting settled in your new home, only to face medical bills with deductibles so high they feel insurmountable. It's no wonder healthcare anxiety outweighs visa worries for many immigrants. Now let's dig deeper. Who's driving this crisis? Labor shortages among healthcare providers are reaching critical levels. By 2036, America could face an eye-popping shortage of up to 86,000 doctors. That's not all. Nurses, physician assistants, and other roles are also dwindling, leaving patients waiting longer for care. And it doesn't stop there. Burnout in the medical field is at an all-time high, with over a third of doctors reporting they're likely to leave their roles within the next 5 years. Can you imagine the ripple effects of that? Then there's the insurance landscape. Vast, complex, and often unforgiving. For immigrants who don't have access to employer-sponsored insurance, the options are limited and expensive. The rise of gig economy jobs and part-time work adds yet another wrinkle, leaving millions without adequate coverage. And as of February 2025, if certain tax credits expire, 3.8 million people could lose their insurance. Immigrants relying on these marketplace plans will be hit especially hard. Imagine uprooting your life to pursue opportunity, only to find yourself navigating a healthcare system that feels completely out of reach. Is that the dream or a nightmare? Public programs like Medicare and Medicaid offer some relief, but their outlook is shaky. Medicare spent 3.7% of America's GDP in 2023, and projections show it'll jump to 5% by what? 2034. Meanwhile, Medicaid faces enrollment drops thanks to stricter eligibility checks, leaving the highest-risk populations struggling with costs that exceed budget rates. For immigrants who qualify for these programs, the unpredictability only adds another layer of stress. And let's not forget the rising tide of chronic conditions. Today, 6 in 10 Americans have at least one chronic illness. 4 in 10 have 2 or more. With delayed preventive care due to the pandemic, the numbers aren't just startling, they're growing. These conditions demand consistent, affordable treatment, something the current system is failing to deliver. Now, think of an immigrant entering this system for the first time, potentially battling language barriers, cultural differences, and unfamiliarity with how to even begin. It paints a bleak picture, doesn't it? To make matters worse, recent policies have made bad situations worse. A 2.83% cut in Medicare pay rates just went into effect at the start of 2025. Marketplace tax credits hang in the balance. And those telehealth waivers so many relied on during the pandemic, they're set to expire, making access to care even more of a challenge for individuals in rural or underserved areas, places immigrants often settle in their early years. The cracks in the system are widening by the day, leaving nearly everyone wondering, when will it break completely? So what does all of this mean? For immigrants choosing to call America home, the real challenge might not be navigating the visa process. It's figuring out how to survive in a healthcare system that seems to demand everything, but gives so little in return. high costs, limited access, overworked providers, and shifting policies. It's a turbulent landscape that countless Americans already find overwhelming. For immigrants, it's even more daunting. But this story isn't finished. The question remains. Will America rise to meet these challenges, or will its healthcare system continue to falter, leaving countless people, immigrants included, wondering if they made the right choice? That's a question we'll all have to watch closely. Learn more about this and other immigration updates at visaverge.com.